Hi, I'm Dr. Theresa Oswald from Knowledge is Medicine. And in a previous segment on this channel, I talked about how some foods can actually help with inflammation and other foods can actually increase inflammation. And I said I would talk more about the anti-inflammatory diet. So that's what this segment's about. So back in the 4th century BCE, Hippocrates said, "Let thy food be thy medicine and your medicine be thy food." So this notion of using food for its medicinal effects has been around since the beginning of documented medical endeavors. And now there's even a whole movement called food as medicine. But specifically today, I want to talk about inflammation and the anti-inflammatory diet. So inflammation is a natural process in our body, and it does help with with healing for some things, like when you have a cut or an abrasion. Some inflammation there actually is a signal for healing to begin, but chronic inflammation can cause a lot of health concerns. And prolonged inflammation can be the source of many chronic diseases. Inflammation has been known to be related to heart disease, depression, dementia, many different health conditions that tend to be chronic in people have inflammation as part, if not all, of the underpinnings of the problem. And especially painful conditions often are related to inflammation. So let's think about how food could be used to reduce inflammation. Well, they've noticed that in certain parts of the world, people tend to be healthier and they live longer, especially in the Mediterranean region around the Mediterranean Sea and also in Asia. So looking at the Mediterranean diet and its health effects has shown that eating a plant-based diet, and when I say plant-based, I mean a diet that focuses around eating more plants. It doesn't exclude meat, but meat is not a big part of the diet. In these cultures, it's more of a garnish than the main component of a meal. So eating more plant-based foods, more home-cooked foods, more foods that have healthy fats or oils in them is the mainstay of the Mediterranean diet. And then researchers have taken those components and formulated a diet around reducing inflammation. The other addition is adding some anti-inflammatory type spices that can also settle down the cascade of events that happen in the body causing inflammation. So there are pathways in our body related to inflammation, and these pathways can be reduced or blocked with chemicals that we get from over-the-counter pharmacies or from your doctor. One class of medicines called non-steroidal anti-inflammatory medications use these pathways from the arachidonic acid cascade. But foods, as you can see in this diagram, also can work and block the same chemical pathways that anti-inflammatory medicines use for their action. And these foods tend to be fruits and vegetables and different medicinal spices. So the things to add to your diet to make it more anti-inflammatory are things that increase our omega-3 fatty acids. So omega-3 fatty acids are essential fatty acids. Essential means that we cannot produce them in our body. We need to ingest them. So foods that are rich in omega-3 fatty acids tend to be flaxseed, whether it's ground or flaxseed oil, green leafy vegetables, sea vegetables, nuts, especially walnuts, and then also cold water fish like sardines, anchovies, and salmon. Those are things that will boost your omega-3 content in the foods that you're eating, and that's why some people actually use fish oil as a supplement to increase their omega-3 fatty acids. Then the other type of food we want to use to reduce inflammation are antioxidants, and these again are found in fruits and vegetables. Foods that are high in antioxidants tend to be the orange, yellow, and red vegetables. So you can think of things like red bell peppers, carrots, sweet potatoes, pumpkins, and squash. Also the dark green leafy vegetables like spinach or romaine lettuce or arugula. Dark colored berries are high in antioxidants, and also teas, green tea and black tea. And also a vegetable that can be used as to flavor foods, such as garlic or onions, are also high in another antioxidant called allium. Also, apples are high in quercetin, which is another potent anti-inflammatory chemical that's an antioxidant. So we want to add those types of foods to our diet, the things high in omega-3 fatty acids and foods high in antioxidants. And then we want to reduce some of the things that can actually increase inflammation. Those would be things like red meat, high-fat dairy, processed baked goods like chips and crackers or bread that can stay in your pantry for a really long time without going rancid or spoiling. Those types of foods have more of the fats that would actually promote inflammation and less of those omega-3 fatty acids and other healthier fats. So that's the anti-inflammatory diet in a nutshell. It's not a diet where you have to be really strict with yourself. You just over time tend to add things that promote the body's ability to reduce inflammation and reduce things that we know actually increase inflammation. And this is a diet that's healthy and been adopted by many cultures around the world and just now has had a name attached to it, the anti-inflammatory diet, because of its use in helping treat conditions that are related to inflammation. So if you like this content, please subscribe to this channel. And if you have any comments or questions about the anti-inflammatory diet, please leave a comment below. Again, I'm Dr. Theresa Oswald from Knowledge is Medicine.